Hi, I'm Jessica. I'm 35 years old and I'm from New York City. I have polycystic ovary syndrome, POCS, and I've had it for several years, and my period was never on time. My gynecologist had given me several hormone medications, but my cysts weren't getting any better. And finally, a friend of mine recommended Guru's Garden, and I had a free consultation with their doctor over the phone. He recommended some Ayurveda medicines, and I placed the order online. Now, after 6 months of treatment, my period is finally on time, and I feel so much better.
Today we're going to talk about PCOS and its effect on the female menstrual cycle. Let's take a few seconds to review the symptoms listed on the screen here. If you suffer from a few of these conditions, there's a chance that you and I have something in common, and that is PCOS. PCOS is known as Polycystic Ovarian Syndrome or Polycystic Ovarian Disease. It's the most common endocrine disorder in premenopausal women. In fact, it affects 1 in 10 women in their reproductive years, and I was one of those women. Almost 4 years ago, I was diagnosed with this medical condition. What's surprising is that most women are actually unaware that they have it. Less than 25% of women with the classic symptoms of PCOS have actually been diagnosed. So what is PCOS in a nutshell? Well, it involves disturbed ovulatory function, hyperandrogenism, which is the increased production in male hormones and androgens, and the growth of non-cancerous tissues in the ovaries, known as cysts or immature follicles. PCOS is becoming more common and affecting more women. Heck, there's even a TV show. Despite its popularity, though, PCOS still has people asking lots of questions, and here's why. It's a complex disorder. It involves multiple hormones and manifests itself differently in every woman. PCOS is also not one condition, but a group of them. So it's important not only to understand the condition in general, but to understand how it affects you. PCOS, or the cause of PCOS, is uncertain. There's no defined cure, and there's no one single test for diagnosing PCOS. Multiple tests are actually required, including an ultrasound to confirm its presence. So, with all these unknowns, we're a little confused. So how does one know if they have polycystic ovarian syndrome? Let's take a look at the 5 main characteristics. Firstly, polycystic ovaries. Poly means many, suggesting that there are multiple cysts on the ovary. Typically, 12 or more is indicative of the disorder. An abnormal menstrual cycle is also common in 7 out of 10 women who experience irregular periods, heavy periods, or infertility as a result of the hormonal changes inside the ovary. Obesity is often seen in 65% of women with PCOS. The extra weight tends to be around the abdomen or the upper body, and often the legs are quite thin. Skin and hair changes also result due to the action of testosterone. So we'll see things like oily skin, acne, increased facial and body hair, as well as female hair loss or male pattern baldness. And lastly, shifts in metabolism, primarily insulin resistance, which plays a key role in PCOS. So which of these characteristics is most important? The truth is they all are. If you have at least 2 of the features listed here, you could have PCOS. Like in my case, it was polycystic ovaries and the absence of a period. As mentioned, the cause of PCOS is unknown. However, there are several factors that play a role, namely insulin resistance. Let's take a closer look at why and how. Many women with PCOS tend to make too much insulin, and it is possible that the ovaries react to this by making too many androgens or male hormones such as testosterone. Excess testosterone may stop ovulation, causing irregular periods and difficulty getting pregnant. When excess testosterone goes into the bloodstream and circulates the body, it reaches the skin, and the testosterone makes it oily, stimulates hair follicles on the face and body, and it also causes the scalp hair to thin. Now, on the other side, insulin has an effect on how the body stores energy. It stores it in the form of fat and carbohydrates. This results in weight gain, especially in the upper body and abdomen. What I find particularly interesting and very complex is the effect PCOS has on a woman's cycle, possibly because I went without a menstrual cycle myself for over 18 months. To help you understand this, let's go on a journey. When monthly bleeding ends, the hypothalamus secretes a hormone called gonadotropin-releasing hormone. GnRH stimulates the pituitary gland in the brain to release follicle-stimulating hormone and luteinizing hormone. These hormones direct an ovary to stimulate egg maturation and start making estrogen. The first full that ovulates releases its egg into the fallopian tube for a journey to the uterus. This follicle changes to something called the corpus luteum. The corpus luteum is a factory for making progesterone. And this huge surge in the hormone progesterone puts the uterine lining in a ripening phase and turns off further ovulation by either ovary. If the egg is fertilized, a fetus develops and thus a new life begins. If fertilization does not occur, the ovary stops its elevated production of estrogen and progesterone, which causes the shedding of the uterine lining and bleeding, hence menstruation. Then, in response to low hormone levels, there's a rise in GnRH and the cycle begins all over again. Let's switch gears and look at a woman with PCOS. The hypothalamus still secretes gonadotropin-releasing hormone, but as a result of other imbalances, such as insulin resistance and elevated estrogen, the pituitary gland releases abnormally high levels of luteinizing hormone into the bloodstream. Without sufficient FSH, follicles do not mature and ovulation does not occur. With no egg released, the follicle remains and does not change into the corpus luteum. Without the corpus luteum, the secretion of progesterone is suppressed and estrogen becomes more dominant. Without progesterone, the uterine lining does not develop. And without ovulation, no egg is available to be fertilized, and hence menstruation does not occur. Now, as we know, insulin plays a role by increasing testosterone. And we know that testosterone suppresses ovulation, among other things. So this would explain, in a very simplistic view, why women with PCOS tend to have infrequent, irregular, or absent periods. Now here is a visual to help decipher the difference between a normal ovary and a polycystic ovary. As you can see, the polycystic ovaries have multiple bumps or follicles, which are essentially premature follicles that have never released an egg. And on the right-hand side is an image of an ultrasound photo of two polycystic ovaries.